My name is Takaaki Ohyama. I'm from Tokyo National Institute of Infectious Disease and National Institute of Public Health。上は国立感染症研究所、下は国立保健養科学院というところなんですよね。The National Institute of Infectious Disease is in the Shinjuku. It's just across the Waseda Universities. And Public Health, it's in Saitama. Saitama Wako City. Wako City is just outskirts of Tokyo area. And so today Thursday, and next week Thursday. So today and next week I'll be here to talk about some sort of infectious disease in general, and also field epidemiology itself. What I want to convey to you and give you some information or give you some lecture is about some sort of infectious diseases or infectious disease in general. I believe many of you have a background knowledge about infectious diseases. I'll give you some basic ideas of how to get some infectious disease control among human population in general itself. And epidemiology. I believe you had a lecture about epidemiology, right? And exam soon or already finished. Anyway, so exam have a lecture about epidemiology or biostatistics. どうですかね? So what is some idea about epidemiology or biostatistics? Many times I ask this question to the researchers or some students who are focusing on the research science or so. So those of you answered research, epidemiology or biostatistics is some sort of tool of research. どうですか? エピデミオロジーとか疫学とかいうのはそのリサーチの道具という返事がよく返ってくるんですね。How about that? Yeah, however, so my boss many years ago talked to me epidemiology or statistics. Okay, today I'll talk about epidemiology and statistics combined. Let's say epidemiology. Epidemiology, we have two kinds of epidemiology. One is a research epidemiology. Research epidemiology is some sort, exactly, tool of research. But now, today, I will give you some idea about field epidemiology. Have you ever heard field epidemiology? Field means this. どうですか? これはあまり聞いたことがないですか? レクチャーでも. How about that? How about field epidemiology for those from overseas? Field epidemiology is some sort of tools for real public health issues. この2つのエピデミオロジーってよく言われたんですよね、私のボスが。Research epidemiology, those are exactly tools for research, making study designs and analyzing the data. However, we have another epidemiology tool for public health. これを日本語では実地疫学というんですよね。日本語がなかったから、実地っていうのは実際の実験の字に地面の字と書いて実地疫学。And also, have you ever heard field epidemiology training program? これ聞いたことがありますか? How about from students from overseas participants? Have you ever heard field epidemiology? Okay, so that's some sort of introduction. And today I'll bring three parts. The first one is, what is field epidemiology? Explaining a field epidemiology. So talking about my background. これちょっと私の自己紹介しながらこの field epidemiology っていうのを紹介いたしますね。I believe, I know maybe many of you have very little idea about field epidemiology, but you've learned epidemiology itself, right? Lecture, case control study, cohort study. 習いましたよね。それはよくご存知だと思います。まだ試験は終わってないよ。The first one is field epidemiology with my introducing myself. The second one is field epidemiologist. Field epidemiologists is those who are able to work in the real public health world with knowledge and skills of epidemiology and biostatistics. 実際の公衆衛生の現場で、問題の現場でエピデミオロジーとかスタティスティックを用いて動き回るパブリックヘルスプロフェッショナルの話。それが So how do they work? How do they think about communicable disease control? ちょっとピンとこないかもしれない。時々日本語で挟みますね。ちょっとその方が良さそうな感じがします。And the third one is some short exercises, group works. Such group work will give you some story type case studies, and you are expected to do some priority setting exercise and also setting a control objectives in terms of communicable diseases. So, yeah, actually, as I mentioned, past few years, 7-8 years, I've been here to talk with you in this course, but the main objective, Kihara Sensei invited me every year, and main objective of this course is, I believe, to give you some idea about future career path, because many of you, ちょっとピンとこがしら皆様、日本卒業したらどうしますか How about your future career? Think about that. Working in the universities, Kyoto University, it's one option. How about that? Another option, working in some other universities or some big companies to working with the knowledge and skills of epidemiology or public health, or research field. どうですかこちらで皆さんリサーチフィールドなんかに興味があるかもしれない。I believe many of you are interested in the research-oriented future career path. But one of the reasons Kihara Sensei invited me to talk with you is to introduce you to another career path. Public health practitioner. Give you some ideas or flavor of public health practitioners. ですね、公衆衛生の現場でというか危機管理の現場で働くキャリアパスもあるよっていうのを皆様にちょっと紹介してほしいっていうのもあって私をいつも招いてくれてるんだと思ってます。So, actually, my background, actually I was graduated from the medical school in Japan. When I was a medical student, I'm very interested in some tropical medicine or international activities or focusing on the public health, or especially in the communicable disease. However, after spending several years I'm graduated at the universities, after spending several years in the public health field, I realized I have to study again. どうですか日本のカリキュラム大学 This is graduate school. So how about undergraduate school in university in Japan? 皆さん大体日本の大学卒業してるんですよね。I realized, so when we work in the public health, that means working the some health issues among human populations. So I have to study, I thought I had to study again. 人の集団の中で仕事をするのもっぺん勉強しなくちゃならないなというのをちょっとかなり感じたんですね。You also have? But you spent several years in public health field, right? After graduating at university in Japan. So that's why you are here. And me, so did I. So that's why I studied in the universities in the United States and Europe again and again, and got some about skills and technology, get some skills and knowledge about epidemiology, and I called myself as a field epidemiologist. So what is field epidemiology? Maybe this chart you've seen this definition. You've learned this definition quite often. Epidemiology, health something, right? 疫学の定義っていうのはたくさん何回も見たと思います。But as I mentioned, epidemiology had some two types of epidemiology: research epidemiology and field epidemiology. Research epidemiology is a research-oriented action. Yeah, it's focusing on the research-oriented activities. And field epidemiology is useful for those who are really those who have to work in the real public health world to tackling with the health crisis issues. How about from overseas, from Iran? So you had experience in some public health, right? And also hospitals. Did you study some epidemiology, statistics, or public health in your undergraduate or medical school? Yeah, but not so many, right? Mainly focusing on the clinical medicine. Not so much.
Not so much, yes,
But
in Iran, because of the they have a special program for doctors in the
oh, I see.
because of the many diseases that we are facing nowadays near to the border, especially near to Pakistan.
I see.
So the doctors that they are going to work in the community.
Uh-huh.
have to pass,
I see. That are some special cases, right? Okay. But yeah, okay. Let's get back to some field epidemiology. But somebody called field epidemiology quick and dirty, especially research epidemiologists called us as quick and dirty. ですね、リサーチエピデミオロジーとフィールドエピデミオロジー2種類あると言いましたけども、これ I'm not completely agree with this division, two categories, field epidemiology and research epidemiology. But research epidemiologists always blamed us means field epidemiologists as a quick and dirty. But quick and dirty means it's not so exactly right, exact scientific, exactly statistical right. わかりますかね、このリサーチエピデミオロジストは我々のような実際の現場で働くフィールドエピデミオロジスト、あまり厳密ではない、科学的ではないとよく責めるんです。But however, what do you think? In the real public health field, research but when we work on the real public health world, tackling with the public health problem, foodborne disease, foodborne outbreaks, or epidemic, influenza epidemic, or whatever. Quick and dirty is just enough for us because our main target, our main objective is to control some risks in front of us. Management risks. ですね、目の前にあるリスクをなんとかマネージしようっていうのが一番の目標なんですよね。The main objective of research epidemiologists is not main objective, the outcome, final outcome of research epidemiologists is something like write a paper, publishing. どうでしょうね、リサーチエピデミオロジスト。そのファイナルアウトカムっていうのはこのペーパー、articles. However, field epidemiologists, our final outcome is some control of the risk management. Risk management in front of ourselves. And for example, policy change or whatever. いわゆるその目の前のリスクを何とかするのが我々のフィールドエピデミオロジストの目標であって、というのですね、よく quick and dirty と言われるんですね。However, quick and dirty, that's enough for field epidemiologists. But field epidemiology program, この中では FETP, Field Epidemiology Training Program 聞いたことがないって言ってましたよね。Right? So I've been working this field epidemiology training program for more than 10 years, almost 20 years. Field epidemiology training program, it's some sort of capacity building training course. It's based on the National Institute of Infectious Diseases. 国立感染症研究所にある2年間のプログラムなんですよね。The main objective is to develop a core capacity of field epidemiologists in Japan. in Thailand, in your country has a very old history, more than almost 30 years histories of field epidemiology training programs, and I have a lot of friends in your countries. So in Japan, we developed our FETP in Japan in 1999. I'll give you some background. Why Japan established a field epidemiology training program? 日本には99年にやっとできたとこなんですよね。In Thailand, it's more than 30 years ago, but in Japan, we started 1999. So it's 18 years old or 16 years old. Yeah. I'll show you the background. I'll give you some background why Japan started FETP, or Japan need this desperately about field epidemiologists. Do you remember in 1996 we have a 0157の EHEC. You know EHEC, enterohemorrhagic E. coli infections. Have you ever heard Osaka 1996 we have a huge outbreaks of EHEC? Have you ever heard about that? Or do you remember 1996? ここら辺で関わったこと、somebody was involved in such outbreaks? Foodborne outbreak? どうですか？関わったことは子供、もう何年前かな、20年ぐらい前ですよね。関わりになった方いらっしゃいますかね。So this is one of the eye-opening event for Japanese communities and Japanese government, and they recognize it is necessary, it's desperately need for the field epidemiologists, those who are working in the real public health programs with epidemiology or statistics. And before that, we have some sort of public health systems to tackle with risk management of health problem issues. もちろんその前にもいろいろあったんですよね、保健所のシステムっていうのは。However, that system is focusing on some sort of spot by spot management type strategies. スポットバイスポットっていうのは、いわゆる日本語で説明するとモグラ叩き的なこのリスクマネジメントのやり方だったんですよね。どういうことかっていうと、スポットバイスポ日本語で言った方がいいね。そしたらスポットバイモグラ叩きっていうのは、いわゆる何か問題が起こるとそこをポカッと叩く。それで一応終えてもう完了。でも実質的な本質的な完結には至っていないということをよく言われるモグラ叩き式解決法っていうんですね。Let's think about EHEC in 1996. It's more than 7 or 8,000 people, mainly kids, school kids, children, were affected in that area, in that 1996 event. And many of them have died. It's more than 20 years. So at that situation, its magnitude of the outbreaks and some spread of the outbreaks is quite unique, and it's one of the first experience for Japanese communities. あるいは、自治体を超えてかなりこの規模も大きかったですよね。So that's why some traditional or conventional Japanese public system were not able to manage such system. いわゆるちょっとあれはマネージできなかったんですよね。それでちょっと一つこの FETP がそのバックグラウンドをもとに FETP をなんとか打ち立てようと。So the objective of a field epidemiology training program is, as I mentioned, is create a core epidemiologist capacities of field with knowledge of field epidemiology and statistics. ですね、もしよろしかったらこのお話なんかもまたもうちょっと時間作ってお話したいんですけども、ちょっと今回時間なさそうなんですよね。ですから、So I'll give you the homepage of FETP and National Institute of Infectious Disease. So please look into it later. However, so our team is some 2-year on-the-job training programs. 2年間国立感染症研究にベースを置いているんですね。2-year on-the-job program, and so 2 years, the doctors and nurses, veterinarians, and public health professionals all over Japan will get together in National Institute of Infectious Disease and establish a team called FETP。こういうふうな教室タイプのレクチャーじゃないんですよね。今全国からそういったドクターズナースを呼んできて国立感染症研究所でチームを作ってもらう for 2 years and working on the real public health program and obtain an experience of risk management issues in public health focusing on the communicable diseases。実際に経験を積んでいただいた2年間。それで after 2 years they'll go back to the some original places, original post or universities, big hospitals, public health、自分の元来たところに戻っていって。Then after that, we set up a networks of field epidemiologists in all over Japan. So those are some sort of final long-term perspectives of FETPs. 日本語ではもういいですよね。そしてですね、however, as I mentioned, we started in 1999, so for 2 years program. So we have now this year 17th cohort and 18th cohort we have in National Institute of Infectious Diseases. でも数が少ないんです。However, the capacity of the team is that's a problem. It's not so big. Every year, 4 or 5 members we enroll. We recruited from all over Japan. So that's why. So after more than 18 years, around 60 members, 60 graduates, 60 epidemiologists were already scattered around Japan. I believe it's not enough to set up networks of all over Japan. Thailand spends 30 years for developing FETP and quite a huge capacity of field epidemiologists all over Japan and not all over the countries. And not only your country, but also surrounding countries, your FETP dispatch your trainees for risk management issues, Laos and Cambodia, Vietnam. So Thailand is some sort of strong country in terms of field epidemiology. もしですね、日本のこういったシステムに興味があるんだったら、ここにちょっと So if those who are interested in the これスキップしますね。ここら辺はちょっとあんまり関係ないところですので、interested in the field epidemiologist or those who are interested in the some another future career path as a public health practitioners or field epidemiologists, please look into this homepage, National Institute of Infectious Disease。国立感染症研究所で調べたら出てきますから。So, I hope some of you will interested in this project and these programs, and maybe in the future, we hope to have a chance to work with you. もしこういうふうなですね、future career、ちょっと sorry about that. So from time to time, I have to speak Japanese to strengthen their understanding. もしこういったような FETP というふうなこのフューチャーキャリアパスに興味があるようだったら、ぜひちょっとホームページ覗いてください。あまり知られていないキャリアパスだと思いますので、そういった目的で木原先生を私に招いてくれてお話しするっていうのが一つの大きな隠れた目標だと思いますので。So that's the first part. Maybe this is one of the first exposure to you about infectious disease itself and infectious disease prevention control among human population. Some of you, many of you have experiences working in the hospital. 病院で働いている方案外いらっしゃいましたよね。Maybe those who have experience in the hospital, maybe they know some sort of infectious diseases. But infectious disease in individual patient is quite different from infectious disease among human populations. どうでしょうね。病院でドクターとナースいらっしゃいますか？ドクターズナース、大体ホスト患者さんを目の前にしてっていうふうな感じですよね。Okay, sorry about that. Just explaining in Japanese. そしたらその方々だいたい患者さんが前に来ると、その、病原体なり臓器なりそこら辺に焦点を当てた活動ですよね。ちょっと乱暴な言い方をすると。または感染症ならその病原体なりに。でもこれから今日私がお話ししようとするのはその、パブリックヘルスのパースペクトこの、infectious disease among human population この人の集団の中での感染症対策ということをお話しします。これはあまり本にも載ってませんし当たり前すぎて載ってませんけれども、どちらかというとこの患者さんよりもこの周りの健康な人たちこれが活動のフォーカスの対象なんですよね。あまりそこら辺はバックグラウンドにないかもしれませんけれども、ちょっとそんな風な感じでちょっと聞いておいてください。Now I'm explaining the communicable disease among individuals and the communicable disease among human populations. That means when you're working in the hospitals, so you're waiting, roughly speaking, you're waiting for the patient, right? Patient with some bacteria, patient with some diseases. Let's say this is a patient, and you're waiting in the hospitals, roughly speaking, and your main focusing, your main target of your activity is this person, or this organ, or this bacteria. That's some sort of infectious disease in individuals. However, infectious disease among human population is, our public health professionals or epidemiologists. Of course, this disease person with bacteria or person with virus or person with some disease organ, it's important. However, the main target or main focus of our activity is the human population among this person. So roughly speaking, so that's some big difference between communicable disease in individuals and communicable disease among population. So when I talk this issue to the lectures, many of you are confused. Why? Because ちょっと頭のスイッチひねるのが難しいんですね。臨床の方々、臨床で働いてきた人は理解してもちょっとなかなか頭のスイッチをひねって人の集団を考えるというのがなかなか難しいんですよね。Now I'm talking about some difficulties in switch off and switch on among some infections of the working in hospitals and working among human populations. So this is the key slide of the second part. How do we means public, okay, so this morning we means field epidemiologists or public health professionals. 私たちっていうのはそしたらこの午前中はフィールドエピデミオロジストまたはこのパブリックヘルスの公衆衛生の従事者とか考えておいてください。病院なんかで働いているドクターとかナースじゃなくてですね。So how do we think about communicable disease control among population? This is the key slide of the second topics. Now, これは本当にit's too simple, too self-explanatory. これ案外簡単でもどこにも載ってない話なんですよ。これ簡単すぎてあんまり話にも教科書にも載ってない話なんですよね。I'll give you some idea. For pathogen, いわゆる病原体ですよね。これが this side is a human individual host. こちらが環境なんですよね。Did you learn some communicable disease lecture about 3 key components of infectious disease, communicable disease? 習いましたっけ？いわゆる宿主、環境、病原体。日本語で言うとこれよく習いますよね。So, important 3 components of infectious disease: host, pathogens, environment, right? So, quite often we found these 3 components at the beginning of the textbooks. Host, environment, and pathogen is traveling around between environment and host. Let's say pathogen is exposure to the host. ここにexposure って暴露するですよね。And then, among in the human bodies, the pathogen can survive. Let's say that's an infection. いろいろちょっと定義はあるけれども、今日の午前中はですね、so infection means the pathogen can survive in the body. Let's say so. And then, in the human bodies, the pathogen survived and have some the human beings have some symptoms. The host has some symptoms. That means we call disease this morning, infection disease. And then after that, the pathogen is spread from infected person or diseased person by way of, difficult to read, it's a vertical, direct touch or direct contact. Vector っていうと媒介動物ですね、日本語で言うと。Vector, mosquito or some other animals, insect. And これすみません、sorry about this. It's the environment, like contaminated food とかdirty water or something like that. So pathogen is by way of this part, environment, and then to the another. So it's a self-explanatory and very easy, right? どうでしょう、バックグラウンドない方にもこれよく説明するときによくは分かっていただけるんですけども、下手にバックグラウンドない方が。So, for those who are working in the hospital as a doctor or nurses, no, they are working, 例えばここにラインを引きますね。Now we are there, the nurses and doctors in the hospital, they are working below this part. They are waiting for the diseased persons in the hospital, roughly speaking, ちょっと乱暴な言い方でですね。And then they will provide some management, clinical management, and they have two choices, death or alive. これもroughly speaking. However, our public health professional field is above this line. 上とか下とかどっちがいいとかどっちが悪いじゃないんですね。ちょっと言っておきますね。So, as a public health practitioners or field epidemiologists, we have to think about this chart in order to control communicable disease among human populations. That means to cut this cycle. That means it's a control of communicable disease among human population. 日本語でちょっと説明 Sorry about explaining in Japanese a little bit. とにかく公衆衛生のパブリックヘルスプラクティシナーまたはエピデミオロジストってですね、人の集団でこの感染症を考える場合はとにかくこのサイクルのどっかを切る。特に難しい話じゃないでしょう。特に病院とか医学メディカルのバックグラウンドがある方に当たり前と思われるかもしれないです。ちょっとこれが理解してもちょっと出てこないというか身についてこないというか、ちょっとそこら辺がいつも感じているところなんですね。But now this morning I will give you some idea and about some other using some another examples. そうだな。よし。Okay, so I'll move on some examples. そしてこの Now we'll think about this chart and I'll put 7 points for this cycle in order to control communicable disease controls. As I mentioned, in order to control communicable disease among human population, we have to cut this cycle anywhere, any point. Make myself clear? It's okay. It's easy and self-explanatory for those who have not deep knowledge about infectious diseases. そしてこれもどうですか、日本語でも。これはちょっとあまり簡単であまり本にも書いてなくて当たり前すぎるとよく言われるんですけども、ちょっと今回はこれをいきますね。理解してもちょっとなかなか使えないっていうのがあまり病院とかそこら辺で働いてた方々にはよく見られることなもんですから、ここで繰り返させてもらいます。I'll give you examples. これ、 For example, we have a vaccinations. If we have a vaccine, like let's say influenza or measles or mumps or so, if we have a vaccine, we can cut this part. もしワクチンがあったらここら辺いくら暴露してもこっちの方に進むここら辺をカットできますよね。Yeah, we have a weapons called named vaccine. We can cut this part. And also prophylaxis. Prophylaxis, you have some idea about prophylaxis, right? Malaria or some other bacterial disease. 予防内服って日本語で言います。prophylaxis。マラリアの予防内服とか、あとジフテリアなんかの抗生剤の予防内服とか、インフルエンザのタミフルとか予防内服とか聞かれたことがあると思います。If we have a prophylaxis, this measure we can cut this part. And it's a clinical management field below here. We have a treatment and rehabilitations. We can put some control point here, management point, let's say management point. And here, isolation and treatment. When we would like to cut this cycle, maybe I'll come back with some examples. Maybe it makes you clear. このアイソレーションとかトリートメント、日本語で言うとですね、隔離とかそんなのを言うんですね。今、隔離とかいう言葉あんまり使われませんよね。病院で働いていた人はどう言ってました？ So, when you work in the hospitals and when you encounter some influenza outbreaks in your ward, let's say, どうしてました？ For example, you are working in the hospital as a doctor, right? どんなことしてました？インフルエンザが出た場合。隔離って言ってました？本当に。Now, 隔離 in Japanese, it's not a good word. とよく言われたんですよ。今、コホーティングとか言えませんか？
コホーティングっていう場合もありますけど、分かりにくいので。
Okay, anyway, but isolation, so isolation treatment, but basically, in order to control communicable disease among human population, the basic point is, as I mentioned, isolation. Physically separate healthy person and unhealthy person. Or infected person. That is some sort of key component of control, communicable disease control and prevention among human population. ですね、いろいろちょっといい悪いはありますけれども、とにかく健康な人と非健康な人を分けるっていうのがある程度この危機管理の根本になってくると思います。Of course, we have to think about ethical issues or human rights or whatever, but basically, separate physically, time and place. That's also important issues for public health risk management issues. And control, this control point is, for example, prevent a contact. コンタクトを避けるなら or vector, kill vectors, kill mosquito or whatever. Environment. Provide safe water, clean waters、とにかくきれいな水をあげるとかそんな風な感じですよね。And prevent the exposure, prevent this, to cut this cycle, prevent the exposure is, let's say it's one of the example, repellent to prevent insect bite and bed net or yeah, and wearing a long sleeve or whatever. So this is just self-explanatory issues. ちょっとこれは簡単なことだと思うんですけれども、ちょっと例を挙げますね。Yeah, as I mentioned, so it's too easy and too textbook style. So maybe some of you or many of you have some idea. Didn't realize it's important, but however, I'll give you some examples. But okay, from friends from Thailand. So let's say you are epidemiologists or public health professionals. Now we have encountered tuberculosis TB outbreaks or TB. We have to working on the TB among human populations. So think about this cycle. TB is a bacterial disease. 細菌によるTB っていうのは結核なんですよね。結核は細菌による感染症。And how the bacteria transmit in terms of TB, transmit to others through cough or droplet, right? But TB is, strictly speaking, it's an airborne disease. But this morning, I do not move on to the exact strict definition of airborne or touch or whatever. あまり詳しいことは言いませんね。あまり厳密なことは言いません。Let's say droplet. So the epidemiologist, the public health professional, can draw this chart. そうするとですね、our epidemiologist とか public health professional はこれ頭の中でこの絵を描くんですよ。Yeah, so public health professional will draw this chart in my brain. How do you cut this cycle in order to control TB among human population? For example, using your knowledge about TB in the textbooks or
Using masks.
you what?
Using masks.
Masks. Okay, prevent, for example, masks. Maybe this part. How about the vaccine? We have a vaccine, right? BCG. You have a BCG in your countries. But BCG, but North America or European countries, they do not have BCG. 日本は BCG ありますよね。In Japan, we have a BCG because BCG is not so effective for TB among adults or whatever. But this morning, we do not move into such discussion in detail. そうすると、then our public health professionals would like to put this control point, control start. With vaccination, BCG, we can cut this cycle of this point. Prophylaxis. Did you have experience about working in the TB outbreaks in the community? No? How about ありました? In Japan, we have a lot of episodes about TB outbreaks among communities, right? You're working in the public health office. How about others? Or others working in the hospital? 病院で働いてた人もなかったですか? Okay, so now you're working in the public health office. If you encounter the TB outbreaks, どうします?予防内服大変ですよね。For example, okay, just explaining in Japanese. 日本でですね、よく塾の先生が的確に感染しててっていうのはよくニュース、よくっていうかありますよね、よく。そうすると子どもたちに感染の可能性がある場合、よくそんなのどうします?予防内服させますよね。これが6ヶ月ぐらい飲まさなくちゃダメなんですよ。こういう事件が大なり小なりいまだに続いてますよね。So that's a prophylaxis. And if, for example, the teacher was infected in the TB, and how do you work on the student in the classroom? Maybe it's better to give them some prophylaxis, some anti-TB drugs to them. And the students have to take drugs for more than around 6 months. It's long. It's too much for them. And as you mentioned, masks, isolation, let's say, to prevent the spread of bacteria from diseased person to the healthy person. こういうふうにちょっと使うんですね。Diphtheria, okay. How about dengue? Dengue は知ってますかね。Dengue is a viral disease. And for example, デングはご存知ですか?デング。どういうふうに感染するかってよく新聞なんかで知ってる知識で十分なんで。Do you know? Yeah, デング。そうだね。vector. デング is a viral disease and virus transmitted by way of mosquito. ベクターですよね。エリス・エジプト熱帯島か。Right? In your country, you have a lot of problem about dengue, right? And also dengue disease, dengue infection. It's a wide spectrum disease, right? Many of the infected person by dengue virus is it's okay. It's a たくさん別に問題ない no problem. However, some part 10 or 20% have some symptoms of some common cold or right? 普通のちょっと 10%、20% ちょっとよく覚えてませんけれども、ちょっとした症状です。And very small part the dengue hemorrhagic fever, dengue shock syndrome、かなりデング出血熱、デングショックシンドロームとかそういったのに進む方もいらっしゃる。Then, okay, so you do not have a medical background, and I'm asking you, so how do you control dengue among human population? In other words, how to cut this cycle somewhere? Do you have several points to cut this cycle? というお話なんですけど。
一つは蚊の発生を防止す
る。ここですね。顔。他はまあそれですね。How about that? So as we see in the TB, do we have a vaccine? でも残念ながら unfortunately we do not have a vaccine, right? And do we have some good medicine, effective medicine for dengue? Maybe no. Dengue viral disease, we have very little weapons for tackling with the viral disease. ここら辺の薬もないんですよね、いい薬。So, as you mentioned, all we can do for dengue control among human population is this part, vector part, killing the mosquitoes or killing the babies of the mosquito. ミジンコじゃなくて何て言うんでしたっけ？そうそう、ボウフラを殺す。breeding side protection. And coming back to the dengue problem in Japan, have you ever heard a dengue problem in Japan 2 years ago? You're here in Tokyo? No, Japan? Really? Yeah, we have a dengue problem. But again, actually, dengue, 皆さんもまあちょっと今回ちょっと時間 Okay, so maybe we'll skip the dengue issues. Measles. Measles. We have another. ちょっともう一つくらいしかない。Measles. はしかですよね。はしか。マシン。Measles is a viral disease, right? You know. Measles ははしかはどういうふうに感染しているか。Maybe you have some idea about how to transmit measles viruses. It's airborne diseases. So if I have a measles virus, if I had a measles here, maybe I'll infect all members in this classroom in very short period. measles virus 特に感染力強いもんですから、この部屋ぐらいだったらみんなに私が持ってたら感染させる。So it's a very strong infectivities. And how do you control 皆様はバックグラウンドがある人じゃない人はいましたっけ？まあその OK. So for example, measles はif we control measles among human population どこを切ります？ Where is the cut point of this circle in order to control measles among human population? Yeah, we have a strong weapons about vaccine. We do not have effective drugs, right? Measles disease. So let's forget about this. And case management, we maybe forget about this part. Only vaccine is a strong weapon for us. はしかのワクチンっていうのはかなり有効なかなり強力な武器ですからね、私たちの持って。Cut this part. So as I mentioned, measles is airborne disease, so almost impossible to prevent or cut this part. はしかは空気感染なもんですから、ここの方をカットするっていうのはちょっと難しい。Something like that. So I'll show you how to use this chart, how to draw this chart in the brain in the public health professionals or epidemiologists, how to use this chart to pick up some control point or cut point of this circle. These are some key of some way of thinking in terms of communicable disease control and prevention. Sorry about some in Japanese. 結局これがですね当たり前かと思うんですけども、このパブリック人の集団の中でこの、コミュニカ感染症をコントロールしようとするときにかなり簡単すぎますけども有効な話なんですね。ただですね、さっき結核とか出しましたよね。あまり厳密に言いすぎると結核の専門家でこの話はしない方がいいです。言うとですね、ちょっとそこはあまり乱暴すぎるだろうとか厳密じゃないとかよく言われます。さっきのクイック&ダーティーと同じですね。ただこれで十分なんですよね。パブリックヘルスの人の集団の中で危機管理を考える上では。Yeah, today I'll explaining some sort of how to grasp, how to obtain some general view of the infectious disease or prevention and control of communicable disease. I'll bring, so based on such ideas, next week I'll bring some ideas, a way of epidemiological way of thinking, how to investigate the outbreaks. そういったアウトブレイクのインベスティゲートっていうのは全部まとめたやつですね。そのどこが感染経路で感染経路でリスクファクターがどこか。So investigated means for our epidemiologists identify sources, infectious sources and transmission route and risk factors of the infection or whatever. So that's all issues we call investigated outbreaks. Outbreak investigation と言います。それは来週も。So I'll come back with that ideas or such lecture series next week. その来週ちょっとまた持ってきますね。今週はちょっとこの簡単な考え方だけを。So those are some second talks. So as I mentioned at the beginning of this lecture, I have 3 points. The first one is give you some idea about field epidemiology. フィールドエピデミオロジーのその紹介ですよね、1本目が。2つ目が The second point is give you some idea about how the field epidemiologists think about communicable disease control and prevention. フィールドエピデミオロジストまたはパブリックヘルスプロフェッショナルと言い換えてもいいですけれども、その人たちが人の集団の中での感染症をどのように考えるかっていうのが2つ目の話。So that's this chart. So shall we move on to the third part? On this third part, it's some sort of very short group exercises. So maybe I'd like you to strengthen your understanding about communicable disease control and prevention among human populations. So this exercise is some simulated stories with the case studies and disease transmission and control. Hope all you have some idea. Okay, so we have 2 parts, part 1 and part 2. If possible, if we have enough time, we'll move on to the part 2, but basically focusing on the part 1 of this exercises. The name of this exercise is disease transmission and controls. Objective is, maybe here, you can read it later, but the main activities you are expected to do on this exercise is the part 1 is now we have several explanations of these situations. Disease land, the name of our world. ちょっとまた後で言います。And then on this disease land hypothetical countries in Africa, no, in Asia. So you are the epidemiologist or public health professionals of this hypothetical country, disease land, let's say so. And you are expected to prioritize or identify some priority diseases you have to work on based on some very limited information on these sentences. So that's some sort of the main activities of this morning. ですね、この家庭の国の中でちょっとプライオリティをセッティングしてもらいますというのがエクササイズなんですね。Okay, so disease land objective, the aim of the exercise is to provide practical framework for understanding issues in disease control. They identify potential control method assess these control measures for feasibility, availability, effectiveness, and cost. Now I'm reading in the front pages. Define a quantitative control objectives based on selected control measures and epidemiological data. However, now turn it over on part 1, page 2. So maybe you have some idea about disease land. It's a roughly speaking, it's a この貧乏な国です。It's a poor country, right? Typical developing countries with a classical disease and the population pyramid is like here. It's a lot of younger age groups. And as you see in the table 1, next page, page 3, it's a classical infectious disease, communicable disease, main care disease for children, not only for children, but also for other communities. So now you have some idea about the situation of communicable disease. Yeah, you have some systems or immunization program or HIV control programs, but we are not sure it's working well. まあ何らかのシステムあるようなんですね。イミュナイゼーションプログラムが HIV とか情報ありましたけど、ただそれがうまくいってるかどうかわかんない。And the next paragraph, it's not so directly linked with our exercises, but I explain a little bit. The next paragraph shows us some health system in this disease land, and it's a conventional system, central and regional or prefectural and locals. And the public health system is also there, 3 tiers, and also laboratory is also 3 tiers, and also private sector is going on. Private sector is still on. And the last part is private sector is growing, especially in urban areas. Typically developing countries with some part, some special area is it's a rich area in poor countries. まあティピカルなこのディベロッピングまあ開発途上の国だということをイメージしてください。It's a typical developing countries. And as I mentioned, you are epidemiologists, public health practitioners, and the last part is you have asked by the Minister of Health, 厚生大臣、まあ保健省の大臣ですね、to look at the program of infectious diseases in this country and to report back on a number of issues in disease control. とにかく、so ministry, health ministry is asking you several questions based on the table 1. Now you have information about table 1s. It's just a very simple, take a look on this. And do some point, can I have say one point about table 1? 何かコメントをもらえます table 1. Whichever is okay. For example, which some disease is a high number of patients or
The prevalence of Japanese encephalitis
Japanese encephalitis.
is not like any other diseases.
Thank you very much. Yeah, Japanese. So he said JE, Japanese encephalitis. 日本脳炎ですよね。Japanese encephalitis is it's not like other diseases. We call epidemic-prone diseases. That means 00 and 1000 and 00 epidemic prone. 何か一つコメントもらえますか Can I have some comment on table 1? Okay, thank you very much. She said the number of malaria cases is increasing year by year. How about some from Thailand? Friend from Thailand? One comment, just all we have is this table. Yeah, yeah, looks like number of cases are increasing. But as you mentioned, we do not know because we do not have denominators and the time frame. But let's say in the bracket, parenthesis, is a number of deaths, right? In terms of HIV/AIDS, it's a high case fatality rate. Right? For example, in 2000, 200 cases and 190 died. I'm not sure it is true or not. But anyway, so this is information, all we have now. And the Minister of Health asked us to prioritize diseases. The page 3 below the table. each participant should examine the information on table 1 and set up 12 diseases and to coin high, medium, low priorities for each diseases. Thinking about disease impact, international elimination, and variability, affordability. 日本語で説明すると、この12の疾患をちょっと、プライオリタイズしろ。どれが一番重要か、この国でっていうやつですね。Yeah. So the minister asks you to prioritize these 12 diseases, high, medium, low. So that's some activities you are requested in the past 10 minutes. This is the poor countries. So only 3 high priority diseases. Not 5, not 6, only 3 priority diseases. 貧乏な国だから3つの肺は3つだけにしてくださいね。ということで、その座ったままでいいですから、ちょっとひっくり返ってもいいですから、ちょっとこれでこの3つのグループ考えてもらえますか。そして、after 5 minutes, you have only 5 minutes. 5分にしましょう。5 minutes. So some of the reporters of each groups will present here. Give me 3 highs. あとは medium, low は Okay, so today, this morning, we have a very severe time constraint. So let's say only give me high. So this group gave me 4 highs. Okay, この真ん中のテーブルは誰か Okay, so could you give me some justification or reasons of why you choose these 3s? Just very simply.
Actually, we have 4 top high priority. But
4.
we exclude measles because it seems that the vaccination programs is increasing.
I see. So maybe that's all. Measles is maybe okay in the future, near future. I see. How about TB? Why you choose TB? TB is a number of T.
Because of our crowding, and also the population under the 50 years old. Most of this, I think, among the children.
I see.
So, and also they have the problem with overcrowding. Their population is increasing.
I see.
So TB would be a problem for them.
Maybe so. Yeah, maybe so. The many of the groups.
50% of the population are under the 50 years old. So most of them are child.
I see.
So the rate of the deaths, even from the malaria, the consequences among the children, most of the deaths are among the child.
Okay.
And the HIV is a future problem. It's a future problem because this young population are going to have like sexual relations in the future. So they have to have some plan for that right now.
Okay. Yeah.
Just 3.
Okay. yeah. But the other group also choose TB, malaria, HIV/AIDS. どうですか？あとこちら大体同じような as he said, as that group said, some number of cases increasing, and the risk groups, children, the population of the children's group, the portion of the children is increasing, and malaria and measles. どうですか？これミススはここ真ん中のグループは so this middle table has some measles is more important than HIV. これはなんかディスカッションしました。Yeah, in the middle table, measles is important than HIV.
3つっていう話。
So only so limitation 3 is
その次だったら
I see.
HIV とか入ってくるかなと思うんですけど。
Okay. So actually, I reviewed this exercise in various groups, developing countries and developed countries also. How about, I have one comment. How about cholera, J, as I mentioned, epidemic-prone diseases. How it's important of this country disease land? Did any group discuss about that? このエピデミックプロンディジーズは重要じゃないでしょうか。Okay, so this group, could you explain エピデミックプロンディジーズはどうですか？そうね。How about that epidemic prone disease? What do you think epidemic prone disease? Is it important of this country? High priority? What do you think?
This is acute disease, I think. This caused a huge death at a very short time. So it's one of the priorities for that we always have to have it at the top list. But all the diseases that we discuss are not that acute. They don't cause the epidemic like cholera. Cholera caused maybe more than 1,000 people like 3 days. We had the cholera outbreak back in Europe. In 3 days we had 2,000 cases just in 2 days or 3 days. It's very bad, and all of them are. And this country is most of them are child. Most of the deaths are occurring in the child.
Yeah.
So it's also important.
It's not so important, you said so. Okay, how about that? No, yeah, important. However, compared with some other diseases, for measles, TB, in some groups from, for example, I worked with this exercise with some African groups, student groups in let's say it's a developing countries, developing areas of Africa. So it's a Central Africa, and they said JE, cholera, epidemic prone disease. That means on table 1, 00,000, 00. So they said they can forget about this because they cannot afford to work with them. However, no, I worked with some student group from Europe, North Scandinavian countries, and they mentioned if outbreak was occurred, thousands of people were infected or affected, and many are died. So they have to do that. They have something to do with that. So that's their logics. Think about that. It's epidemic-prone disease. Let's say in disease land, for example, Japanese encephalitis, once in 5 years, epidemic of Japanese encephalitis. And let's think about pandemic influenza issues in our countries, in the current world. Pandemic influenza, how many times in past 100 years? 何回ぐらいありましたっけ ?4、5回 ?5 times? Or past 5? 過去1年間 past 100 years. どうですあれ So, thinking about this situation and thinking about their logics, in African groups, they said they forget about the pandemic influenza because 5 times in 100, almost nothing. They said so. But European countries, Scandinavian students, they mentioned if outbreak was occurred, many hundreds of people are affected and many have died. So they have to do that. They have to prepare for that. So we have to prepare for the pandemic influenza, even though we do not have much resources, human resources, some capacity, capital resources or whatever. So that's their discussion. So I do not say which is right and which is wrong, but it depends on their situations. どう思いますか? So sorry about Japanese. 今パンデミックインフルエンザの話ちょっと持ち出しましたけれども、過去100年間に何回でしたって 4、5回かそんなもんですかね。そんなものほっときゃいいっていう理屈ですがね。お金がない国々から来たの方々。ただ日本とかアメリカと今だったら出たらえらいことになるのになんとか備えなくちゃならない。100年に5回としましょうか。これはどうでしょうね。今これ皆様にちょっと答えあげることはできない。So I do not have a good answers to you. At the Scandinavian groups and some very poor country group, So maybe they have their logic and justice. So I do not say which is right and which is wrong. What do you think? So just give you some ideas. そういうグループがいて、こういうふうなプライオリタイゼーション、そして実際にパブリックヘルスにやっていく場合はそういったようなことが多かれ少なかれ毎回ありますから、ちょっとこういうふうなことも考えていただきたいということを思ってこれ持ってきたんですね。So that's a part one. However, もうalmost the end of the lectures. So, if we have time, we'll move on to the part 2 using the chart, infectious disease chart. However, so we do not have time. So as I mentioned, so I'll move on to some summaries. So today, I brought 3 topics. The first one is field epidemiology, and hope you have some idea or some flavor of field epidemiologists, the public health practitioners. That's the first topic. The second topic is, so those public health officers or field epidemiologists, how do they think about communicable disease control among human populations? So I gave you such chart. Too simple, too self-explanatory, but it's good to think about some control measures among human population. And the third one is, I will give you some exercises under some time constraint and give you some idea, give you some way of thinking about prioritization and give you some problems you have to encounter in the near future or in the future when you're working in the public health or any kind of population health issues. この3つを持ってきたんですよね。ちょっと今日はわやわやして何とも伝えきれなかったところがかなりあるんですけれども、So I'll come back next week as an epidemiologist, field epidemiologist, and as somebody, as you mentioned, so we'll bring about outbreak investigation or investigated some risk management issues using epidemiology or statistics. 皆様このケースコントロールスタディとかコホートスタディとかなんか聞いたことは習ったんですよね。Okay, so I'll review such epidemiological way of thinking and give you some idea how to put these techniques or information into real world. ということで来週また戻ってきますので。And if you have any questions or comment, また私がいるときに。So これ12時まででよかったんですよね。Okay, so that's all for today. Okay, thank you very much for joining. And sorry for time constraint and a little bit mixed up. ちょっと日本語と英語でややこしかったですかね。ちょっと私もちょっと慌てふためきました。ということで、そしたらまた来週戻ってまいりますので。